So, good day everyone. Now I will be demonstrating TPR vital signs to read the patient's chart. So, patient's name, Magno Marisa C. Date of birth, December 29, 1975. Room number null 1, PIN 123456. Patient is under the service of Dr. Regine Sotes. Primary complaint is dengue fever. Condition is stable. Ambulation, no restrictions. Diet as tolerated. Order is TPR every 4 hours. Next is to check for the functionality of your equipment. First is your thermometer. Check if there is any battery left. Okay, good. Next is for your stethoscope, if there is still a sound. Okay, good. Next is for your sphygmomanometer. Okay, good. Doing this will save you more time if ever you will encounter any problems while doing TPR. In doing medical hand washing, first, you must observe body mechanics. Put a good lather soap. This is to avoid cross-contamination. And then proceed back to the nurse's station. After doing the necessary things in the nurse's station, you may now proceed to the patient's room. Good morning day ma'am. Ako day mo nurse for today sa AM shift, 6 to 2 p.m. Ako day si Nurse Solanjan Marines Magno, but you can call me RJ. Pwede ko makabaw sa iyong pangan ma'am?
Marisa Pamalog Magno.
Sige, thank you. So, mag-start dito take sa imong thermometer ma'am ha, sa imong temperature I mean. Before taking the temperature, you must first do the swab of the alcohol to the thermometer to ensure sterility or cleanliness. Start from the probe to the bottom. Next is to put the probe into the axillary area of the patient. You may roll the sleeve of the patient and wait for the beeping sound to stop. You may also start counting the respiratory rate while doing the temperature. Okay, now that the beeping sound is now heard, you may now take the temperature. Imong temperature di ma'am is 35.8 and then imong respiratory rate di ay is 20 respirations per minute. After taking both the temperature and the respiratory rate, put the results in a jot down note. After taking those two, you may now take the patient's pulse. Ma'am, kuha ko sa imong pulso, ma'am ha. Take it for 1 minute. Okay, ma'am, yung pulse today is 79 beats per minute. Now, after taking the pulse rate, put it in the jot down notes. Then, you may now proceed on taking the blood pressure of the patient. Makaka-feel di kay slight discomfort ani ha, kay mo piit ni siya sa imong kamot ha. Put the cuff above the antecubital fossa 2 finger breadths away. Put the stethoscope above the antecubital fossa. Mong BP day ma'am is 95/60. Normal lang siya ma'am. Also, do not forget to clean back your thermometer with an alcohol swab after taking the temperature of your patient. Now, from the bottom to the probe. Now you have done taking the vital signs of the patient. You may now proceed back to the nurse's station and put the results in the patient's vital signs monitoring sheet. After taking down the patient's vital signs, you may now input from your jot down note into the vital monitoring sheet of the patient. You will use the designated colored pens to input. Now you are now done with taking of the vital signs of the patient.